I am secondary student. Can I know your name and your IC number?
My name is Anis Nadira binti Sefiniza. My IC number is 0512.
Alright, so today I would like to spend some of the time to discuss with you how to care for your atriovenous fistula, which is known as AVF. This session will take about 15 minutes. Is it okay with you?
Okay.
So this purpose is to help you understand how to take care of your AVF at home and to know complication and when to seek for medical attention. So before we start, can I know how are you feeling today?
I feel good today.
Alright, thank you. So may I know if you have received any education regarding AVF before this?
Not yet.
What do you already know about AVF?
I didn't know much, but all I know is that I have to spare one arm.
Okay, that's a good thing. Thank you for sharing. It is very helpful. So can you tell me why you need dialysis treatment?
Because of the kidney failure.
Alright, that's the correct answer. Because your kidney is no longer functioning very well. So dialysis will help your body to excrete waste product and also excess fluid from your body. So for dialysis to work effectively, we need a good vascular access. In your case, your vascular access is AVF, atriovenous fistula. So can I know where is your AVF located?
So here.
Alright, very good. So before we begin and before I explain further to you, this is a brochure.
Okay.
You can hold and see while I'm explaining to you. So AVF is a connection created surgically made by a surgeon between an artery and vein. So normally, artery carry blood with a high pressure from the heart to all over your body, while vein carry blood back to the heart from all over your body. So when they are connected together, the vein become larger and stronger due to increase the blood flow. So this stronger and larger vein can be used repeatedly during dialysis. So AVF is considered the best type of dialysis access because first, it lasts longer, and then it has a low risk of infections, and then it have a lower risk of clotting, and it provides better blood flow. So that's why we often call AVF as a lifeline. So can you repeat after me what is the AVF important?
So AVF important as access for hemodialysis.
Yes.
And then it lasts longer and low infection risk.
Yes.
Yeah.
Alright, that's a good answer. Alright, so one of the most important thing to do is to check your AVF site daily. So can I know, do you check your AVF site every day?
Yes.
Yes, okay. So every day you should inspect for, first, you should look for redness around the site of the AVF. And then is there any swelling in the AVF site? Is there any bleeding occur or pus from your AVF site? Or the skin breakdown? And also if you apply a gentle pressure, if you could feel any pain. Okay. This may indicate infections or damage of the AVF. So let me show you. So first, you apply a gentle pressure and you should feel no pain. So do you feel any pain?
No.
No. Okay, so you can see at your side, is there any redness right now?
No.
No. Is there any swelling?
No.
Also, is there any bleeding and pus?
No.
That means your AVF site is very good, in a good condition. So if you notice any signs of symptom, any signs of infections, you should contact your dialysis center immediately.
Okay.
You understand me?
Yes.
Excellent. Alright, another important thing is to check for your trial. Do you know what is trial before?
No.
No, it's okay. A thrill is a vibration that you could feel at the site of the AVF. It means that blood is flowing at your AVF site. So if there is no thrills, what could it be?
Infection, or blood clot.
Yes, correct. Excellent. It means that your AVF site is blocked. So can I show you how to check for the thrills? Can I show you how to check for the thrill? Alright. So first, place a finger gently over your AVF site. So, can you give me your finger? Okay. Gently. Can you feel the thrill?
Yes.
Alright, good. That means you have a good blood flow. So you should check this thrill every morning and every night. So if you cannot feel the thrill, what could you do?
Contact medical healthcare worker.
Correct. You should seek for medical attention immediately because loss of thrill means that your AVF site is blocked. So now let's talk about how to keep your AVF site clean. So can I ask you, how do you keep it clean?
Always wash it with, always clean it with soap and water.
Soap and water. That's the correct answer. So you should wash the AVF arm every day using soap and water only. So you cannot use any chemical or alcohol rub to make it more clean, especially before dialysis sessions. So what do you think cleanliness is important for your AVF site? Why do you think it is important?
To prevent infection.
That's correct. To prevent any risk of infection. Because a clean AVF will reduce the risk of infection. So, you also need to avoid some of the things, which is first, scratching the area of the AVF, picking a scabs, and also applying unproofed cream, even a lotion. You cannot apply any lotions, especially before your dialysis sessions. So, if you have cuts or wounds near the AVF site, please inform your healthcare provider immediately because it could be a risk of infection at the AVF site. Do you understand me?
Yes.
So, do you normally carry a heavy things at home?
Yes.
Oh no, that's not a good thing to do.
Oh.
Do you live with other family member?
Yes.
Oh, can I know who?
My husband.
Alright, so it will be good if you ask for your husband help to carry heavy things for you because you should avoid lifting heavy objects with the AVF arm because it will actually damage the AVF and also make the AVF block. So examples of heavy things that you can't lift is first a bucket full of water, a gas cylinder, heavy grocery bags, and also large luggage. So heavy lifting can damage the blood vessel and reduce your blood flow. So the next one is you should also avoid pressure on your AVF site. So do not sleep on the AVF arm. Do not lean your body towards the AVF arm. Do not wear a tight clothes. Do not wear a tight jewelry like bracelet, bangles, watches, or even rings. So, why do you think it is important to not give any pressure at the AVF arm?
To prevent from blocking the blood flow?
Yes, it is true because of the pressure can reduce the blood flow. So, it can damage the AVF sites. So another important things that you should remember is never allow any blood pressure measurement at the AVF site. Never allow any blood sampling taken from the AVF arm. Never allow any insertion of IV cannulations and also injections on the AVF arm. So if you visit another clinic or hospital, always tell the staff or healthcare staff that you have an AVF arm, and you should tell them that you spare left arm means that you cannot do anything on your left arm. Can you repeat that to me?
So I have to prevent this arm from insertion of cannula, blood taking, and if I go to any other clinics, I have to inform the medical worker there.
Alright, that's a
To spare
correct
this up.
thing to do. Alright, so after AVF surgery, some patients are advised to perform certain exercise. So for example, squeezing a rubber ball. This helps to improve the blood flow, to strengthen the vein, and also to promote maturation at the sites. So would you like me to demonstrate to you how to use the balls?
Yes.
Right, so first, you place it in your arms, in your hands of the AVI, and then you like this. Do not apply a full pressure, just a gentle one. Alright, can you do it for me? Alright, that's a good one. So, I have discussed with you about infections. Can you tell me what infections look like?
Like redness, and there's swelling over here, and then feel the pain, yeah,
Alright,
and pus.
that's a good one. Okay, if you look at the brochure, one of the signs of infection includes redness, swelling, pain, pus, fever, and also warm. If you feel warm on the side of AVF arm rather than your right arm, you feel cold, and this one you feel a little bit warm, it could indicate sign of infection. Even if you have a fever, so if this occur, please seek medical attention immediately. So sometimes bleeding may occur after your dialysis sessions. So if bleeding occurs, you should first apply a gentle pressure. You use a clean gauze to apply a gentle pressure and keep the arm elevated and seek medical attention if the bleeding persists. Do you understand?
Yes.
Alright. So a clot may form inside in the AVF. So the signs include that you need to watch out if there is any clot. Is first, there is no thrill. Next is swollen arm. And the last one is difficulty during dialysis. So this require urgent treatments because it means that your AVF site is blocked. Sometimes less blood flow to the AVF arm because of the block. So you may notice a cold finger on the AVF arm, numbness, tingling, and also pale skin. Please report this symptom immediately to the healthcare worker if occurs.
Okay.
Beside of the AVF care, attending all your appointments is very important, and oral dialysis session is very important. So do not skip your dialysis session. Even if you feel that you are good and you're well, please do not skip your appointment and sessions. So follow the fluid and restrictory diets advised by your doctors or your dietitians. Avoid smoking and drinking because smoking damages your blood vessel and may affect the AVF site. Can I ask you a question?
Yes.
Do you smoke?
No.
Do you drink?
No.
Alright, that's a good thing. So next one is regular physical activity as advised by your healthcare providers. So it can help maintain overall your health, overall of your health body. Okay. So before we finish our sessions, I would like to check your evaluations and ask you some of the questions.
Okay.
Is it okay?
Yes.
Alright. So first, could you tell me when should we check for the AVF? How often should you check for your AVF?
So we have to check every morning and every night for the symptoms. For example, like infection and blood clotting and everything.
Alright, what should you feel for?
So I should feel for thrill every morning and night also.
Okay, that's a good. Can you take blood pressure on this arm?
No, I have to spare this arm, and if I go to any clinics, I have to inform them first.
Alright, so what are signs of infections other than redness and also pain?
So basically, I have to feel for the warm, swelling and pus, and red. Yeah.
Alright, if you have any fever, what does it mean?
Oh yeah, that means I infected.
Yeah, you may be infected. Alright, so what should you do if there's no thrills?
So if there's no thrill, I have to inform good doctor, and I have to seek medical help immediately.
Alright, it's a good one. So can you carry heavy things with this arm?
No, because it can reduce blood flow and it can damage my vein.
Alright, so for the last questions, why is your AVF important for you?
So basically, my AVF is important as an access for hemodialysis, since this site is used to filter my blood instead of my kidney.
Alright, thank you, an excellent answer. So, in conclusion, today we discussed about what is an AVF, how to inspect it every day, how to check for the thrills, infection preventions, protecting the AVF arm, sign of complication and infections, and when to seek for medical attention. So before we finish, do you have any questions to ask me?
For now, no.
Alright, thank you for cooperation and for your time. I hope this information is helpful for you.
Yes.
And I hope you can take a good care of your AVF and maintain a healthy dialysis sessions.
Okay.
Thank you. Welcome.
Bye-bye.